Good morning. Okay, let's get a little sound check first. Check, 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 sound check. Let me take a look at it here. Okay, here we are. Check, check. Check, check. Okay, sound is good. Thank you, Linda, for checking the sound. So, so today is Saturday. Yes, 9:30 now. This is our usual Saturday morning yoga therapy class, and as you know, we've been doing it for a long time live. Now we're doing it in person. And sorry, we're doing virtual now. We used to do it in person. Now we're doing virtual, and we started doing the topics based on what we get the request from our audience. So, the recent conversation between few physicians and non-physician friends, what I need to do to be disease free, to live longer. Okay, here is a person who lives 90, 100. He said, she said, I eat little, I do more exercise, I have, uh, I meditate, I mean, the ways and ways of their discussion. So we are Western trained physician. So our biggest question is, as a physician, if we look at a person who lives disease free 90, 95, 100 years or 110 years, or today our expectancy is 120 years. So what is physiology behind it? Physiology behind it is they're always in a parasympathetic tone. What does parasympathetic tone means? If you put them on a health tracker, what I have an Apple Watch now, and first if you look at their heart rate, when we put a health tracker, or you can say heart rate monitor, their average continuous heart rate is less than 65. I've tried it many times, many people who are in that group, and how they achieve it, the ball is in your hand. If you look at their sleep pattern, they don't sleep that much. They may sleep even 4 hours or 6 hours. But most of their sleeps are deep sleep. Most of their sleeps are a non-REM, your stage 3, stage 4 deep sleep. So the sign of health is we talk about a strong digestion, easy elimination, and good night's sleep. Next, what we noticed. We're sharing with you because that's what you ask us to show it to you. Next, we find it out the relaxation response, what we as a physiological term say parasympathetic activation, which they are having throughout the whole day, they don't even know about it. It is a purely an effortless ease. The moment you make an effort, I have to get up 5 o'clock in the morning, I have to get up, I have to run, I have to do yoga, I have to do cooking, I have to go to job. The moment you do it, With an effort, it becomes sympathetic and it's going to hurt you. Whole life should be like you're brushing your teeth. Whole life should be like an effortless ease, because what you are treating here is called a dis-ease. D-I-S space E-A-S-E. Dis-ease. In Sanskrit, it is called your ashuk. All means no, shuk means your happiness. The happiness is gone, it's called ashuk. So, the question I get even from my physician friends, okay, I'm going to practice a relaxation response, I'm going to practice in yoga, I'm going to practice a asana, pranayama, meditation, but tell me how to start, how to do it, give me the protocol, give me the sequence, which one you do. Answer to that is, it is a gain. You're making an effort. That effort is going to hurt you. So, what you need to do with the practice, you develop a lifestyle which is primarily based on yogic and Ayurvedic lifestyle, which we call the dinocharya, daily routine. And you will see in the daily routine, everything is built in to be a relaxation response. So now, if you want to see what we do, I mean, you're great, you're doing good job, good work, everything. I have so many people. I have an irritable bowel, I have an overactive bladder, I'm losing weight, I'm not eating well, and my doctor cannot find anything. Got all endoscopies done, I have all my blood work done, you name it. The blood work looks like a blood work of a teenager, but it is the underlying sympathetic overdrive. First, in the morning, how you incorporate, not how, you're doing it. You don't even know you're doing it. When you get up in the morning, we sleep on our left side, left lateral side, with a fetal position and generally with the Adhi Mudra. This is called a Balamushti Mudra or Adhi Mudra. Why? This is the mudra you will see. Infant sleeps, baby sleeps. Healthy baby will eat, poop and sleep. If a baby does something else, the baby is not healthy. So this is the way we sleep. When you get up in the morning, you follow the rule of 90 seconds. Rule of 90 seconds means when you get up in the morning, first you do not suddenly get up. During sleep, two physiological changes happens. One is a profound muscle relaxation. And second, your lowering of your body's internal core temperature. Body temperature goes down. Then we have a lot of physiological changes during sleep, which is basically, we call it a recharging your body or repairing your body, including your growth hormone level. We can go over all this stuff, but basically profound relaxation of the muscles and lowering of the inner body core temperature. The moment you get up, body compensates by tightening the muscles. Because the muscles are all relaxed, they get tightened up. So you don't suddenly get up in the morning. You get up, you sit down on the side of the bed and sit down, as I said, the rule of 90 seconds, said 30 seconds. Why 30 seconds? It is not a 30 seconds. By the time you practice initially, then you will see when you close your eyes, It is not 30 seconds, and by the time you finish it, you will see it has become 30 seconds. Same way as you call brushing your teeth. Next, from here, you stand up. You stand up and stay here another 30 seconds. Why? You are also preventing what is called a postural hypotension. What is a postural hypotension? Postural hypotension is the sudden change in your posture. Suddenly getting up from sitting or laying down to standing, your blood pressure drops down. Posture means posture hypotension. Hypo means lowering of your blood pressure. Posture lowering your blood pressure, you get a little bit of a blackout spell, spinning, and that's the time you may fall. And as you know, the number one cause of death for all the senior people is a fall. People ask me one very simple thing. So if somebody is living 100 years, 150, 105 years, or 110 years, what is the cause of their death? Primary cause of their death is basically a fall. They start losing their balance, and one day getting up to the bathroom or going to the kitchen, they fell down, they break the hips. That is the most common thing, breaking the neck of the femur. They do orthopedic surgery, great. They do well under local anesthesia, under fluoroscopy, they nail it, pin it, but that is the end of their life. Fall. If they don't have any fall, the terminal event in their life is either a urinary tract infection or respiratory infection. Infection of your lung or infection of your bladder and the kidneys. Very interestingly, at this age of whatever, 90, 100, whatever age you want to pick it up, their body doesn't respond to infection. That means when they have a urinary tract infection, they do not have any fever, they don't show any sign of infection, suddenly they became confused. I've seen so many people in their life, they get confused and they go to the hospital and behold, they have a urinary tract infection and that's the end of their life. So coming back again, rule of 90 seconds. 30 seconds you're sitting down, 30 seconds you're standing up, and 30 seconds now you're walking, slowly walking. When you are walking towards a wall. So come to a wall, you just got up in the morning. So the whole thing is incorporating in your daily lifestyle. Put your ankle at the touching the wall. Touch your hips, touch your shoulder, touch your head, and close your eyes. Breathe out first. Slowly, effortlessly, you breathe in, then breathe out longer than breathing in. What it is, breathing out is parasympathetic. Breathing out is a relaxation response. And when you start doing it, breathing out longer than breathing in, you remove more carbon dioxide, more toxic elements from your lung, you have a more space in your lung and get a lot more oxygen in your body. Also, you develop a neuroplasticity, so that's the way you breathe. So I'm talking about it because you stay here between at least 5 to 10 breaths. When you're completely relaxed, you can put your hands all the way high up. Close your eyes. Breathe out longer than breathing in. There will be profound level of relaxation. Body tightness is going to go away. Why? Because your spine is straight. See, what happens, we have the muscles on the side of your spine called paraspinal muscles. Those muscle contracts to keep me in an upright position. See, if I don't have the tone of those muscles, my skeleton will fall in front because of the weight of my skull. So these two muscles are contracting to keep me straight. So if I myself, or if we keep our body straight, doesn't matter if you sit down in front of your computer, keep your body straight. I have a kneeling stool, my spine is always straight. Sit down in a chair, keep your spine straight. From there, what you do, now you're against the wall, you did things, you get down. Generally, I go to the, prefer to go to the bathroom and will sit down in a squatting position called a malasana. The squatting position is the most relaxing asana. Here, my ankle is relaxed, knee is relaxed, my hip is relaxed, my whole body is relaxed. Also, my pelvic floor is relaxed, my anorectal junction, like the junction between the rectum and the anal canal, where there is a sphincter, puborectalis sling, which prevents a normal incontinence of your stool now becoming straight. We drink a good amount of water, sometimes 2 or 3 glasses of water. I will prefer at room temperature. You can have all different kind of glasses, copper glass. It is an earthenware glass, any glass. But most important, when you drink the water in gulp. Take the water, another gulp. What it does, the whole gulp initiates a peristalsis. And that peristalsis starts your contraction of your colon and also going to have a good bowel movement. Remember, the whole gastrointestinal system from mouth to the anal canal is supplied by parasympathetic nerve. When you are in a relaxation response, I'm talking to you, I'm in a relaxation response, you will have a saliva in your mouth. I'm talking to you, I didn't drink any water, but my mouth is completely wet. Because you have a lot of secretion coming from your salivary glands, parotid gland, sublingual glands, sublingular glands. But those glands secretes because of parasympathetic activation. So in this posture, when you drink water, you get an urge to go for a bowel movement. Get into the toilet and you sit down in the toilet with a squatty potty. Squatty potty comes in a 6-inch and a 9-inch, and when you sit down in squatty potty, you'll be sitting like this posture. Pelvic floor is relaxed, your anorectal junction is straight, and you have a very good bowel movement. And completely functioning colon and an empty colon is a sign of your health. The moment you have a good bowel movement in the morning, you have a wonderful day. the moment you are carrying that stool in your colon or in a rectal area, you are miserable throughout the whole day, and that misery is a sympathetic tone, not a parasympathetic tone. So you're getting up, see, this thing is happening once you get up in the morning, and you're doing it without any effort, effortless ease. You do your next, you brush your teeth, try to brush your teeth with the left hand. Right in the left hand, what happens? You activate your non-dominant. I'm not saying left hand means my non-dominant hand. I'm the right-handed. So if you're left-handed, you try with your right hand. Tongue scraping is a wonderful way to remove all your gunk or the dirt in your tongue, because then the tongue can feel or tongue can do that, the taste of your food and proper digestion. So after brushing your teeth, you wash your nose with your neti part. So when you do a neti part, it is such a powerful relaxation experience that you literally have no idea unless you practice it. So initially when you put the neti pot in your nose and slowly turn your head down, you keep your eyes closed and have your mouth open, and when you slowly turn, the water will come through the other nostril. Initially water may not come out because it's a relaxation response. Initially when you take this one close to your nostril, you will see your whole face is flushed. Your eyes are watering. You feel a tremendous amount of irritation. The moment you keep doing it, slowly and slowly that irritation goes away. And when you keep doing in the opposite side, now you're doing in the opposite side, same thing. You sit down, put a whole lukewarm water with a little non-iodized salt, and if you go to my YouTube videos, you will see them. Probably I will show you one day a live demonstration again. So you will have a totally an effortless flow. It almost looks like, we call it a kunjal kriya, like elephants, water coming out, that there will be no tightness, there is no sympathetic overdrive, it's total relaxation. It's a beautiful, beautiful your daily routine. People ask me, when should I do it? When I get a little bit of a cold, flu, this is part of your daily routine. This is the most relaxing, practice you can ever do. Remember one, when all the irritation goes away, nothing bothers you. Our whole metabolic syndrome, which is called activation of the limbic system, truncal obesity, diabetes, hypertension, coronary artery disease, high cholesterol, dyslipidemia, all comes from we call it a stress, and the stress is defined as called a fear of unknown. Fear of unknown again is what? Something irritating you, bothering you. What a fear of unknown. Yeah, I'm going to take this a plane ride. I don't know whether the plane is going to crash or not. Or my children or my grandchildren are going to the school. I don't know what will happen to the school. Is there a mass shooting in the school or not? Next thing, after this negative part, you have some water in your sinuses. So you stand up, little bend over, and do a little Kapalbhati pranayama. Push your abdominal wall in, it hits your diaphragm, hits your lung, all the water comes out. So like we always do in the morning, and we do have a little bit of drainage throughout the whole day. So you stand up, the way we recommend here, get your head up, do about 5 or 10 counts of Kapalbhati pranayama like this. Turn your head on the right side, again do it about 5 to 10 counts. Turn your head to the left side. Put your head down, another 10 counts. Then you have a frontal sinus, something, and you little bit of hit in the frontal sinus like this. So, at this time, you practice a little bit of Kapalbhati pranayama. We do not recommend you to practice pranayama standing up because pranayama causes little altered sense of consciousness. But the physiology behind the Kapalbhati pranayama is, even it is called your Agni Pradhan pranayama. It ignites your Agni. It is your metabolic pranayama, but really it's activation of the vagal tone. It activates your vagus nerve. So the vagus nerve, which is the longest nerve in our body, which is your parasympathetic activation, you have a right and a left, and it comes between the carotid sheath in the right side. The recurrent laryngeal nerve goes around your right subclavian artery on the left side. The left recurrent laryngeal nerve goes around your arch of the aorta. It comes down. The right one goes behind, the left one comes in front of your gastroesophageal junction. Then it branches into the whole gastrointestinal system. So Kapalbhati pranayama is a wonderful relaxation response and activation of the parasympathetic tone. In a truly yogic lifestyle and truly at this moment, after the Nidipad, we generally do a shower, take a shower in the morning. And in a yogic tradition, we do a self-oil massage called Abhyangam. We do self-oil massage, and many a time, we include a steam box called Swadhana. Oleation is called Snehana. You oleate your body, and the steam box, which is called a perspiration, is called a Swadhana, which is your perspiration. And I'll show it to you one day. Maybe I'll do it with on your telephone, and I'll take it to my my bathroom where I have the steam box, and I'll show you how the steam box works. So, in the shower, we have, we say, not too much hot water in your head. Your head needs a little cool water, hot water needs your body. In one of the yogic language or Sanskrit language, or not, it's just a colloquial term, it says pet naram. Pet naram means your abdomen is softer, not a tight abdomen. Pet naram. Hat garam. The hands are warm. Because see, the moment you have a sympathetic overdrive, you get a vasoconstriction. Blood vessel constricts, blood supply in your hand, because hand is a profound blood supply in your hand. And you know, hand has about 1/4 of our brain controls our hand. So in a parasympathetic activation, hands gets a little warm. Pet naram, hat garam. Shir thanda, mata thanda, means your head is cool. The head is not warm. Hands are warm, but head is not warm. It is cool. Well, a maro doctor ko danda means you don't need a doctor to take care of your underlying disease. So during shower, we try not to put too hot water in our head, but hot water in the body is good. Especially need it because when you're outside temperature, guess what? People are watching from overseas, it is -9 degrees Celsius. People from here about 15 to 20 degrees Fahrenheit. So that kind of a temperature, you need little warm water, but it's fine, warm water in the body and cold water in the head. During the practice, your practice of both asana, pranayama is in such an effortless way that you enter into a meditation without knowing. People, a lot of physician comes to me and says, I just want to learn how to meditate, teaching. I said, listen, meditation is a 7th limb of yoga. Yoga is a philosophy called Yoga Sutra of Patanjali, 196 sutras, of which 193 are to quiet down your mind. And especially in the asana, in the sutra, the main asana being described is called a sthiram sukham asanam. Sthiram is a stillness. Sukham is the happiness. Asana is a pose. You are able to sit down in a stillness. So here I am. I'm sitting down on my kneeling stool. So on a kneeling stool, when I sit down on a kneeling stool, you'll see my spine is straight. The moment my spine is straight, initially I have a 2 piece of a brick on side of my spine. Now I have 2 pillows on the side of my spine. These are all the paraspinal muscles are all becoming less toned and a lot more relaxed and softer. So here it is. My computer table is motorized, so it comes up to the point here. My keyboard is here, screen is here. What our observation is, the lifestyle related disease, one of the biggest group who are developing in very young age are the computer people, IT people. Because of their posture, they're always a hunchback. They're looking at this screen. The asana practice you do, we do a set of asana. We do asana, sitting down, laying down, face up, standing up. Generally 25 minutes of asanas, 25 minutes of pranayama. We rotated that asanas into all the different ways, but we do definitely do a set of pranayama. So in an asana practice, the most important asana practice that we absolutely do asanas without any pain. You're sitting down in a easy pose. If you get into the pain, back off. When you're backing off, you stay in that posture. So what is going to happen that you will develop your, so I'm here, maybe I put my Urdhva Padmasana and I feel little pain here. The moment I feel a pain here, I back off. But I stay here with my eyes closed, breathing out longer than breathing in. And many a time in relaxation, I put my hands in between my toes. These are all very powerful relaxation practice, which I've shown before. And slowly it's going to go down on its own. And also in this posture, your breath has to be effortless. Because your heart and lung is the same organ. If you are putting a stress with a asana practice, it causes the stress in your heart, and the stress in your heart is shown with the effort in breathing. So breathing has to be effortless. Breathing has to be effortless and pain-free, effortless breathing in your asana. When you are relaxed, when you are healthy, you will be able to get up, sit-rise test from here. Oh my God, it's so difficult. No, you get up, you put your feet there, and slowly get up without any effort. Getting up from all the way down to the ground is a sign of your health. You know, I make a joke of this, but I always say only one thing. These are better than your cardiac stress test, better than any known preventive medicine. That means you don't go to see a doctor. But our approach is completely opposite. Our approach is integrative medicine. We practice this, then you go to see a doctor once a year for checkup, and we let our primary care physician or specialist check us and tell, you look good, the number looks good, your imaging looks good, so whatever you are doing, keep on doing it. I may not understand as a Western trained physician what you are doing, but you are doing good. So we want to do an integrative approach, that you are doing a practice. I'm practicing with a health tracker. So I'm watching your cardiovascular parameter, I'm watching my oxygen saturation, I'm watching my sleep pattern. We're talking about science here. Integrative medicine, integrating science with the wisdom of traditional system of healing. able to sit in a spine straight, then able to do a prayer pose to the back. So here you are. Put your hands slowly and you keep it here. Even if you cannot, if you have to start here, start here. Keep your eyes closed. Do the breathing. Okay, you can see it here. Let me see. Okay, so I'm putting my hands to the back and slowly, sorry, let me see what is happening here. Okay, so I'm sorry. You put your hand to the back. Keep your eyes closed. I'm going to show it to you a little bit better. So this is a practice. It comes to you effortlessly. So your hands should come together. Even stay here. Neuroplasticity will set in. Put it higher up, a little bit higher up. You will be in a posture which is your part of your total relaxation response. Your breath is effortless because you can talk, you can sing, and it will go up a little bit higher and higher. And we recommend this to all the IT people, all the computer guys, or anybody who is sitting long time in front of your computer. So one day I had a very fascinating experience. I was talking to her. Say, I'm here. My hands are still in the back. I'm in the prayer pose to the back. And I'm talking to you. I'm even singing, talking. I'm in a totally effortless ease. So, one day, a friend of mine who works in front of computer all the time, I called him or sent him a message. He said, I'm in a AFK. I'm in a AFK and I cannot join you now. So I have no idea what AFK stands for. By the time he came back, I asked him what AFK stands for. He said AFK stands for called away from keyboard. They take a break. So I said, beautiful. You take a break for prayer pose to the back. Take a break for the Paschim Namaskar. Stay in this posture and put your screen, I'm on AFK. You'll be amazed to see how many young these computer people are diabetic, hypertensive, having a serious truncal obesity, dyslipidemia. It is literally, it is we call it a modern century plague. It is a plague. It is killing all of us. I don't know how many of my friends have already left us. And my classmates, I don't even remember. I think last time we talked, maybe about 17 or 18 of us had already gone. So, with the proper asana practice, and if you want to go, you can go back to my YouTube channel, and you can look at the session, how to start a asana practice. But basic asana is all relaxation. You do sitting down, you do your Sukhasana, Siddhasana, Padmasana, you're cross-legged, then you do your, the name of the asanas. If you see that the most relaxing asanas are, with the face down and leg high up, called Utthita Padasana, then boat pose, Nokasana, then you do a knee chest, Pavan Mukta Asana, then you do a bridge pose, Satubandha Sarvanga Asana, then you do shoulder stand, Sarvanga Asana, then you do plow, and also you do sit-ups, yogic sit-ups, face down, you do a crocodile Makarasana, then you do a cobra Bhujangasana, you do a locust Shalabhasana, your bow pose Dhanurasana. But these and you do in sequence, and when you do it, you really don't know even you are doing. But all of them are eliciting your relaxation response. Most important is a pranayama. We, rotate, or we do a different set of asanas, but primarily set of asanas are, as I said, the activating both sides of the brain. That means we do a balancing asanas, because health is defined as a balance of your body, mind and spirit. We activate both sides of our brain, and then also practice a lot of balancing postures. Tree pose, standing on one foot with your eyes closed. If you can stand in one foot with your eyes closed more than 10 seconds, 20 seconds, 40 seconds, literally you are disease-free. Try that and come and talk to me. We have so much of data, we have so many people who got better from our practice that we consider this philosophy now to be a science. Philosophy is beyond science. Or philosophy is when you don't understand science. But philosophy is great. Without a philosophy, you are not going to be a scientist. No? Albert Einstein. Einstein is the greatest scientist of our time, but Albert Einstein was the greatest philosopher of our time. All the scientists becomes a philosopher at the end of their life. Pranayama, we do a regular set of pranayama. Most important is breathing out longer than breathing in, which is your parasympathetic activation. We do a set of, first we do a set of Bhastrika pranayama. Bhastrika, we do hand. You do a slow 20, medium 20, fast 20, that's the one cycle. And then with the cycle, we repeat these cycles, 2, 3, 4 cycles. We also do this Bhastrika, eyes closed, completely effortlessly. Put your hand in completely effortless way. and 250 of them, maybe about 1.5 minutes. But say I'm effortless. I'm talking, breathing, singing. I can do this thing continue. I can do it 500 of them easily without an effort. But this is a totally relaxation response. Even it looks like that you have to be active inhalation and active exhalation. By the time you do it with your eyes closed, it is a wonderful exercise for your lung. You improve the lung function, improve your heart function. Improve your heart function, improve your brain function, improve your cerebral function. Bhastrika pranayama is a gateway to your pranayama practice. A lot of ways you can do. You can, include Bhastrika. We do sit-ups, active inhalation, active exhalation. Stand up. So we incorporate Bhastrika in all of our asana practices as a daily lifestyle, daily routine. After Bhastrika comes Kapalbhati Pranayama. It hits all the organs and abdominal organ, and we also do with all the mudras. Dhyana mudra, Vayu mudra, Shunya mudra, Prithvi mudra, Varun mudra, Shakti mudra, Apna mudra, Apna Vayu mudra. Then your Linga mudra, Ganesh mudra. So we all do with the mudras, because mudras also quiets down your mind. Hand is a connector between body and mind, and mudras literally quiets down your mind. And also it's a air element and a fire element. When you tame air element and fire element, you get a profound level of relaxation, which is basically a spiritual practice. After the Kapalbhati Pranayama, you include a breath holding in inhalation and breath holding in exhalation. Breath holding in inhalation is profound parasympathetic activation, the relaxation response. Breathe out first. Take a deep breath in. Hold your breath and incorporate a chin lock with your breath holding. This is called Abhantarin Kumbhak with the Jalandhar Bandha, and it is called a Murcha Pranayama. It is a wonderful relaxation response. Generally, you can do the practice, breath holding in inhalation, about 40 to 45 seconds. Then you do breath holding in exhalation with abdominal lock. Breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold. Generally, half of your breath holding in inhalation, and also you watch your cardiovascular parameters. We have noticed the breath holding in exhalation, your heart rate goes up a little bit, but it rapidly comes down. That means you do have a parasympathetic activation. We practice all the bandhas, the locks, the root lock, mula bandh, abdominal lock, Uddiyani bandh, chin lock, Jalandhar bandh, and when you do all three together, it's called a great lock or Mahabandh. Use alternate nostril breathing. So alternate nostril breathing is, as I said, you don't push, just close your nostril, breathe out through your left nostril, then breathe in through your left nostril, close your left nostril with the ring finger and little finger and breathe out through your right nostril. Then bring your awareness between your eyebrows, third eye, and also do a balance like a super brain yoga. Use your left hand and hold your right ear lobe and continue alternate nostril breathing. You'll be in such a profound relaxation response slowly that you will be able to do alternate nostril breathing without closing your nostril. Take a look at the pranayama practice on my YouTube channel and you'll see how we do it a daily practice. A Bhramri pranayam, bumblebee breathing, is very good to quiet down your mind. And in a bumblebee breathing, you shut down your five senses, you create a frequency, and our body has a frequency. Two frequency interacts, cancels, it's called a harmonic resonance. You put your index finger in between your eyebrows. You can use Shanmukhi Mudra, or you can use your fingers to close your eyes, thumb to close your ear, close your mouth. Breathe out through your nostril, breathe in through your nostril, breathe out with the sound of a bumblebee. To pumming and cupping, rub your hands. You feel the warmth. If you're wearing eyeglasses, remove your eyeglasses. Put a hand over your eyes. Let the eyes take all the heat from your hand. The heat will relax your ciliary muscles. It will increase the convexity of your lens. Slowly massage your forehead, massage your whole face. All the muscles are attached to your skin. The muscles are relaxed. All the lines, skin lines, all the wrinkles, everything goes away. Massage your earlobe, massage behind your ear, inside your external ear canal. Is a stimulating auricular branch of the vagus nerve, so vagus nerve gets activated. Massage your carotid sinuses. The carotid sinuses are supplied by your glossopharyngeal nerve, and massaging, it really quiets down and cools down your cardiovascular system and nervous system. Goes to the back and massage near the tubercle, so the sternomastoid muscle and your trapezius muscle, which is supplied by cranial nerves, get all relaxed. When you keep on doing these practices, you'll see you'll be done maybe very less than an hour, but we recommend about an hour of practice, because what will happen, this will take you throughout the whole day, and you stay in a parasympathetic activation because nothing bothers you. You let go. The boss is screaming at you, it's his problem or her problem. He didn't sleep last night, or he had a fight with his spouse, or who knows what. It's not you. They never get, you will never get your anxious, the car, you got a flat tire in your car, you're not jumping, a kid is in the back seat, you call the AAA or call your car company, they will come, fix your tire, go. So you stay calm in the middle of crisis. And the physiology is able to learn how to control your involuntary functions. That means able to learn how to control your autonomic nervous system, which will come to you instead of you are going to push for it. The moment you do all the practices, remember, it automatically enters into your meditative state. You don't need to practice meditation. You prepare your physical body with a sthiram, sukham asana, stillness, happiness, in a asana pose. You have your breath called a completely effortless breathing with a low respiratory rate. The rate comes down and it becomes a longer and longer exhalation, longer than inhalation. Who does it? Neuroplasticity. Neuroplasticity does it for your breathing. So said, don't push yourself for meditation. Meditation will come to you. When it comes to meditation, you can close your eyes, you can follow your breath, breath-centered, a lot of meditation. You do breath-centered meditation, you do a visual imagery meditation. You can even do an alternate nostril breathing without closing your nostril. You can do your mindfulness meditation. Whatever you're doing, I'm doing this one, this is my meditation. I'm cooking is my meditation. I'm reading newspaper, that's my meditation. Loving kind meditation. Playing with your grandkid is a meditation. Because playing with your grandkid is a parasympathetic activation. You have no idea how much pleasure you get when you have your grandkid. Because the most important thing about grandkid is you as a grandparents take care of the grandkid and then give it back to the parents. You have no responsibility. You're let go. So that's your relaxation response. So you do the whole work. And again, we recommend the midday meal. Lunch is the main meal. And the bottom line is, you eat all the 6 tastes, 7 coloring fruits and vegetables. And when you're getting into the age slowly, the most important sutra is eat less and move more. Movement is medicine. Exercise is the therapy. But exercise is not pushing yourself to the max. Pushing yourself to the max, huffing and puffing is good to build your stamina. We know for our physiological reason, hypoxia causes tremendous strength and stamina. But for you to get the healing, you exercise behind your breath. That means all the level of exercise, whether you are walking, running, treadmilling, weight training, that you're able to talk, you're able to sing, able to breathe effortlessly. The moment you're behind the breath during exercise, that's your healing exercise. And the yoga practice you're always doing, no pain and effortless ease. It's a wonderful practice. Afternoon, we eat the fruits again in all the 7 coloring, and not only one coloring. We alternate the 7 coloring fruits. Do a very early dinner, about 2, 3, sometimes 4 hours before going to bed. Go to bed by 10 o'clock. Before going to bed, we drink a glass of water. People say, oh, if you drink a glass of water, we get up at night. Okay. Drink half a glass of water. Then you have to get up. Practice it for about a week, 2 weeks, 3 weeks, 4 weeks. Increase the water a little bit more. You'll see you don't have to go to the bathroom. Neuroplasticity sets in. Slowly and slowly, you'll be able to drink a glass of water without any problem, because you need that water for insensible perspiration. What does it mean? When you're sleeping, you are losing water from your body. That's a perspiration. And insensible means you are not feeling it. But you know you're losing water. And again, the dehydration is, hyperosmolar state. And hyperosmolar state creates a sense of all the, groggy feeling, uncomfortable feeling. We call it a jet lag. We call it a food coma. We call it I don't feel good. It's all the hyperosmolar state. Anyway, we have discussed a lot throughout the whole day that it is a relaxation response. And again, urge and come and tell you, it's not that you need to know, this sequence I'm going to do, this way I'm going to do, give me a pattern. Yes, everything is there. You go to my YouTube channel, everything is there. But you pick and choose which you are able to do completely effortlessly and keep doing it. Keep on doing it, you will see. You start with 5 minutes. People say, I have only 5 minutes. I say, okay, go ahead and stand up next to the wall. Keep your whole body straight. Close your eyes. Do the breathing out longer than breathing in. Do it for 2 minutes. You don't have to 5 minutes. They'll come and say, oh yes, I was doing it. It was the next time I see, I was in 5 minutes. I was in 10 minutes. Initially, you need to find time for practicing yoga. And then at the end, yoga finds time for you to have a wonderful, relaxing, parasympathetic activation in your body, mind, and spiritual practice. It's a wonderful time of our life, and if you can grab this concept, and doesn't matter how. She said she does this thing. That's why she's 90. He said he does this thing. It's all effortless ease. Thank you again. I'll be here every Saturday if I'm in town. I do have a lot of program. Oh, in fact, next Saturday I won't be here. Next Saturday I'm going to be in Virginia Beach, Norfolk, Portsmouth area, where we have which, we used to do this program from Portsmouth, Virginia, a place called Sattic Space. The Sattic Space is now being taken over by a yoga studio in Newport News called Zinnia. And I was also teaching a yoga therapy session in Zinnia's yoga teachers training course. And Zinnia is going to do the formal inauguration, and before the inauguration they invited me to go and talk to all the teachers. All the teachers will be teaching to talk about yoga therapy, Ayurveda, for our health and wellness. So I won't be here next Saturday. Next Saturday I will be traveling, and the Saturday after probably I'm here and we'll do a class. Okay. Thank you for joining. Again, if you have any question, comments, please let me know. I'll be glad to answer.